Hello everyone. So today we are going to discuss case number 219 of medicine. A 45-year-old man presents to the emergency department with severe epigastric pain radiating to the back, nausea and vomiting for the past 6 hours. He has a history of chronic alcohol use. On examination, he is febrile, tachycardic and has epigastric tenderness without rebound. Which of the following is the most likely to be raised in this patient? Alpha, serum lipase, beta, alanine aminotransferase, also called as ALT, or alanine transaminase. Charlie, total protein, or delta, serum bilirubin. I am going to give you 5 seconds so you can answer this question by yourself. Yes, you got it right. The answer is alpha serum lipase. Let's discuss why this is the answer. First of all, I want you to recall what is this case all about. I want to say that, I want to emphasize that. What is your diagnosis? Yes, the diagnosis is acute pancreatitis. Let's discuss now. Our answer is alpha serum lipase. Why this is the answer? Because lipase is the most sensitive and the specific marker for acute pancreatitis, which is typically present with severe epigastric pain that radiate to the back. This is the classical presentation of acute pancreatitis, and lipase is the most sensitive and specific marker for acute pancreatitis. Let's discuss why not the other options are correct. Our option was B, ALT, or alanine aminotransferase or alanine transaminase. That may be elevated if the pancreatitis is due to biliary cause. This is called as biliary pancreatitis, but not in the most likely or the early marker for the diagnosis of acute pancreatitis. And here we have the history of alcohol, not the biliary disease. Total proteins, they are usually normal or decrease in the illness, and this is not the diagnostic in the acute pancreatitis. Serum bilirubin, it may be raised if the biliary obstruction is there, but it is not specific for acute pancreatitis. And in this case, we have alcoholic again. Lastly, I'm going to share with you some notes that will help you in the future MCQs. Most common clinical sign of acute pancreatitis is the epigastric pain that radiate to the back. Whenever you see these words in the case, you have to suspect acute pancreatitis. Epigastric pain radiating to the back. You have to first rule out acute pancreatitis. After that, you will go further. First step to do, we do serum lipase. Most specific test is the serum lipase, which is better than amylase. Amylase also can be done. It is also rise, but the most specific one is the serum lipase. They also ask from amylase and lipase, which is most specific. The most specific one is the lipase. Remember that the serum lipase is not the investigation of choice for acute pancreatitis. The investigation of choice for acute pancreatitis is CECT, also called as contrast enhanced CT abdomen. This is for the diagnosis and also for the complication. By the way, what is the most common complication of acute pancreatitis? This is the pancreatic pseudocyst. This is a separate MCQs question. What is the most common cause overall of acute pancreatitis? This is the gallstones. And if ALT is raised than 150 in pancreatitis, this will show us that the etiology is the gallstone. Okay, and what is the second most? This is the alcoholic use. Okay, which is our case. Amylase are also rise, but the lipase is more specific and stay elevated longer. Okay, this is about the amylase and lipase differences. So I hope this video makes sense to you. For more videos like that and the content like that, please subscribe to our channel Sword of Knowledge and share our video with your friends.